I'd like to note that I was about to start filming, and these two boys have decided to fight. This is their daily routine. It's pretty normal. Usually Stubbs wins, but Toby's usually the instigator. Are y'all done? That's a no. Okay. So this is going to be Eucoleus. This is Stubbs. Say hi, Stubbs. Okay, this is Eucoleus. There are two worms that we have for it, Aerophilus and Bohemi. Aerophilus is going to be what's known as the canine and feline lungworm, and so its definitive hosts are going to be dog, cat, and foxes. Bohemi is known as the canine nasal worm, so its only definitive host is dogs. Now, there are some issues or whatever with which role the earthworm plays in the life cycle. Dr. Jeva said that we should consider it just the parotenic host. So for Eucoleus, there is no intermediate host, just parotenic host, which is the earthworm. We didn't really talk about adults. So the eggs, they kind of look like whipworm, except their bipolar pole thingies are not in a straight line. And then Aerophilus, the best way I can tell the difference is Aerophilus fills the entire egg. Bohemi does not fill the entire egg. There's some stuff about one's fuzzy, one's not. I don't like that, so this is how I go off of it. Life cycle. So the dog or the cat or the fox or whatever will eat the eggs with the L1 in them. So the eggs with the L1 are the infective stage. Go to the small intestine. Then they will migrate to the lungs or the nasal, because lungs is Aerophilus, nasal is Bohemi. Then they'll become adults. The eggs will be coughed up and swallowed, so that then they go into the GI tract. They pass into feces, and then they embryonate in the environment. We didn't really talk about any pathogenesis with them. And there's two different signs because they infect different areas. So Aerophilus is going to be more like your lung issues. So bronchitis, secondary pneumonia, cough, dyspnea, and anorexia. Bohemi is going to be more nasal stuff. So rhinitis, sinusitis, nasal discharge, sneezing. That's what I sound like right now. Infective stage, like I said, eggs with L1. Diagnosis stage is going to be the egg, whether or not it's developed into the L1 yet, that's what it'll look like. Diagnosis, fecal float. There will be no Behrman because this is not larva. You only do Behrman for larval things. Treatment is going to be extra label, so fenbendazole and our macrocyclactones. Control, prevent predation of those earthworms and keep the cats indoors. And this is not zoonotic. This is Philoroides, which is also known as the canine tracheal and bronchial nodular worm. So its definitive host is only the canids. It is a direct life cycle, so there's no intermediate or parotenic host. The adults are going to be located at the bifurcation of the lungs because they go there and form nodules. Didn't really talk about eggs. Life cycle. So the definitive host will ingest the L1 stage, and then they migrate from the intestines to the lungs, and then once they reach the bifurcation, they become adults, and they form little nodules there. Then the eggs will be in the airway. The eggs contain the L1 or the embryo, and then these can pass either in the saliva or the feces out. We talked about how mother dogs can pass this to their pups through the saliva by licking them. Pathogenesis, the adults will stimulate nodule formation at the bifurcation. It tends to be asymptomatic, but if it's a heavy worm burden, can cause stenosis and suffocation. The infective stage is the larva, and the diagnosis stage is the egg with the embryo or the larva inside. Diagnosis is sedimentation, but there are a lot of other larval worms that look like this, and so to really identify it, you need to send it to a referral lab. Treatment is all extra label. Ivermectin you can do, but it is trial and error, and there is no control. Its location tends to be the west, and it is not zoonotic. This is Chronosoma fulpus, fox bronchial worm. Toby has been supervising. So the fox bronchial worm, its definitive hosts are going to be your dogs, foxes, and raccoons. Its intermediate hosts are going to be your snails or your slugs, so just think of things with shells. They really talk about adults, and you don't really look at eggs because the diagnostic stage are going to be larvae. Life cycle, you ingest the L3 from the intermediate host, so they have to ingest the snail or the slug. That migrates to the bronchioles, develops into adults, lays eggs, develops into L1, gets coughed up and swallowed, which will then pass into the feces. The snails and the slugs will eat the feces, and in the snail and the slug, it'll develop into L3. Really no pathogenesis. Signs, there really aren't much. Absent to a persistent cough. Infective stage is going to be the L3 in the intermediate host. The diagnostic stage is going to be the larva. Because that is a larva, we can do a Behrman on it. Treatment is going to be extra label with fenbendazole and ivermectin. Didn't really talk about control. Location is going to be northeast, and it is not zoonotic. This is Ailurostrongylus abstrussus, also known as the feline lungworm. The definitive host is cats. So Toby, you are a definitive host. Intermediate host is snail and slug. So Toby, do not eat a snail or a slug. Parasitic hosts include rodents, birds, and reptiles. So Toby, do not eat mice or birds or little lizards. The adults will live in the terminal bronchioles. We didn't really talk about the eggs because diagnostic stage is the larva. Life cycle, you ingest the L3 in the intermediate host or the parasitic host. It goes from the intestines to the lungs. The adults go to the terminal bronchioles where they will lay eggs. They go to the alveola. And then from there, out of the eggs, the L1s will emerge, cough, swallow, go to the feces, will go to the snail or the slug and develop into L3. Pathogenesis, it will form gray nodules that are scattered throughout the lungs. Signs, if it's a low burden, is going to be asymptomatic. Heavy is going to be dyspnea, chronic cough, anorexia, and weight loss. The infective stage, like I said, is L3. That diagnostic stage is going to be the larva, so L1. And diagnosis, because it's a larva, can be a Behrman's, but you can also do a radiograph to look for those gray nodules that are in the lungs. Treatment is going to be extra label, so you can do your microcyclic lactones or your imidazole. Control, prevent the predation of those snails and slugs and rodents and birds and reptiles, and it is not zoonotic. This is Paragonimus calicati, or the dog and cat lung fluke. So the definitive hosts, of course, then are the dog and cat. This one has two intermediate hosts. So the first intermediate host is the snail. The second one is going to be your crayfish and your crabs. There's no paratenic host. So the adults tend to look like just a typical lung fluke. She described it as this one looking like a coffee bean. Personally, it looks like all the other flukes to me. The eggs have that typical operculum look, but this egg has no mycelium in it. It is just an egg. Its life cycle, so the fluke will pass the eggs into the water, where it'll develop into what's called a mycelium. Goes to the snail. In the snail, it develops into a cercaria, leaves the snail, goes to a crab. Crab, it becomes a metacercaria. The definitive host eats the metacercaria, and then it develops into a fluke. So pathogenesis is what is called eosinophilic granulomatous pneumonia. So break it down, eosinophilic, so that's the white blood cell, forms granules, so it can cause like fibrosis and then pneumonia. So the signs are a moist cough, chronic gagging, spitting up blood, and low weight. That infective stage is going to be the metacercaria in the second intermediate host, so the crab or the crayfish. Diagnostic stage is going to be that egg. To diagnose it, you do a sedimentation, and you can also do radiographs to see nodules in the lungs. Treatment is going to be extra label, so fenbendazole and praziquantel. Control, you prevent the predation of those second intermediate hosts, and this, we can be the definitive host. So we would just be like the dogs and the cats having these kind of symptoms and those kind of things. This is Piersonema species. I remember it's the bladder hairworm because Piersonema starts with a P and it causes P. The definitive host is, well, there's two different species technically for Piersonema, and the only reason we need to know them is which host they affect. So Plica is for dogs and foxes, and then of course Felis cati. Cati is cats. The intermediate host for both of them is going to be your earthworm. Didn't really talk about adults. The eggs, the biggest thing about them is like they are going to be found in the urine. So your definitive host will eat the earthworm. The larva, so the earthworm has the larva. The larva will migrate to the bladder, develop into an adult. It'll lay eggs that pass in the urine that go to the earthworm. Signs are going to just be kidney function issues, so cystitis, painful urination, and increased frequency of urination. So again, that infective stage is going to be the larva and the worm. The diagnostic stage is going to be the eggs and the urine. To diagnose it, you do sedimentation of the urine specifically. Treatment, you have to do extended fenbendazole. These are kind of hard to kill, and then it is just not zoonotic. This is Diactophyma renale, which is, or renale, sorry, which is also called the giant kidney worm. So renal, so kidney worm. Okay. Definitive hosts are going to be dogs and humans. This worm scares the mess out of me. The intermediate host is going to be the aquatic earthworm, but the paratenic host can be fishes and frogs. The adults, for some reason, will only go to the right kidney, and they're going to be big and they're going to be red. The eggs, so this isn't the best drawing, but I couldn't really figure out how to draw it. They kind of look like crystallized, and they have this giant dark center in the middle, but they're going to be in urine. Didn't really talk about the life cycle. Pathogenesis, so since they're in the right kidney, they're going to cause pressure necrosis there. And then because the right kidney is affected, the left kidney will be overworked and it'll cause hypertrophy of the left kidney. Signs are going to be your general, like, think of like a kidney, like kidney stone or kidney infection. So dysuria, hematuria, lumbar pain, peritonitis, and vomiting, because vomiting tends to come with kidney issues. The infected stage is going to be your L3, that's going to be in the intermediate host. The diagnostic stage is going to be that egg, or if you accidentally find the adult. So we talk about like in diagnosis, you can find the eggs in sediment, or lots of times people just find it incidental while they're doing surgery, and you could even do radiographs or ultrasound. Treatment, you got to remove it, and you'll probably have to remove the infected kidney as well. And then we can get it, and we can be that definitive host. So we can have this in our right kidneys as well. This is Onchocerca lupi, which is also known as the canine ocular onchocerciasis. So the name just kind of tells you almost everything that you need to know about this worm. So it canine dogs, but it is in cats, and it can also infect us. Ocular, so it goes to the eye. Onchocerciasis is the genus name. So the definitive hosts are dogs, cats, and humans. The intermediate host is what's called a black fly. There's another one in humans that Onchocerca, it can infect us as well. It's a different species, but it's through the black fly as well. The adults will be found in the nodules of they'll form nodules in the subconjunctiva. Sorry, I am so congested. Of the eye. There's no eggs because it's a microfilarial disease, but the microfilaria will be found in the skin. And so pathogenesis, it forms the nodules. So the signs are going to be everything associated with the eye: redness, swelling, photophobia, eye ulcers, and blindness, which can be permanent. Infective stage is going to be coming from a bite from the black fly. And diagnostic stage is complicated because you can identify the microfilaria in the skin, you can identify the nodules with the adults in them, and you can also do symptomatic. Your treatment is also going to be complicated. You kind of need to remove those adults, and it might require enucleation of that eye, the infected eye. Topical steroids and antibiotics, just because it causes so much damage to the eye that you don't want secondary infections. And the systemic antihelminthics to remove those microfilaria from the skin. It is located in the southwest, in the Mediterranean, and we can be definitive host as well. This is Dracunculus insignis, which is also known as the dog guinea worm. And so the definitive hosts are going to be basically like your dogs, your raccoons, those kind of carnivores, but we're mostly going to be worried about dogs. The intermediate host is going to be copepods, so this life cycle does require water. The paratenic hosts also include the tadpoles and the frogs. So we don't really talk about eggs, but the adult females are going to be like in the sub-Q in the wounds. So you'll see like a little worm dangling out. It's the female dangling out their uterine so that they can release the L1s into the water. You won't ever see males because the males die after mating. So you'll only see the females. So the females in the sub-Q will dangle out past the L1s into the water. The L1s will reach a copepod, develop into an L3, which are ingested by the host. The L3 will penetrate through the intestinal wall so that they can migrate to the sub-Q so that then they can do that thing up there. Signs, skin ulcers, they're going to be non-healing like pruritic, so because the worm's just chilling out there, and sub-Q swelling. infective stage is going to be the L3 and either the intermediate host or the parasitic host, and the diagnosis stage is going to be the adult because we are looking at the wounds and IDing it. Treatment, the only thing you can really do is surgically remove it. The old school technique is what's called stick grinding, where you tie up the adult worm and slowly twist it out over a few days. You have to be really careful not to tear it. That's why you have to do it really slow and over a few days, because if you tear it, it can cause major anaphylactic reaction in the dog. It is not zoonotic. There is a different species that is in humans, but it does not include the dog life cycle at all. So this is Diaphilaria immitis, so canine heartworm. Of course, this was a ton of material, so this part's going to take a little bit. And on this board, I couldn't include the cat stuff because the dog stuff was just so much, so I'm going to do a second board for that. So for this one, we're going to do the canids, so that is your dogs, but it includes your wolves and whatever. Intermediate host is mosquitoes. And then parasitic hosts include your cats, your ferrets, your foxes, your seals, and your sea lions. The adults like to live in the pulmonary arteries, and if there's so many of them, they will get pushed down into the right side of the heart. There are no eggs because this is a microfilarial infection. So the life cycle is kind of long. And so we're going to start with its life cycle within the mosquito. So the mosquito has to ingest the microfilaria from the blood of the dog, from an infected dog. In the mosquito, it'll go through L1, L2, and L3, and then it'll migrate to their salivary glands. So when a mosquito bites, it does not initially put it in. When mosquitoes bite, they always spit as part of their bite. So the mosquito bites, it spits the L3, and then they tend to crawl into the wound after that. So then these L3 will live in the subcutaneous tissues for about 3 to 4 days. They'll develop into L4 and migrate to the thorax, where they become an immature adult. And they'll stay in that phase for a few months. Then they will get pushed into circulation, which is where it puts them into the pulmonary arteries. There they mature into adults and they mate, and then they make microfilaria that get passed into circulation, which is what allows them to go into the mosquito. Okay, so pathogenesis, it depends on what stage and everything that you're in. So there can be aberrant migration that's actually zoonotic for us. The mosquito can't ever reach the heart for us, but it can be aberrant migration. So the adult heartworms, what they do, they cause pulmonary hypertension because it is in the right side of the heart, can have thickening of the blood vessels, pulmonary edema, so swelling around the lungs, obstruction within the heart, which is what can cause your cable syndrome. What's so scary about heartworm treatment is that when you start treating for these adult worms and they die, they can form a thrombus that all gets pushed out of the right side of the heart at the same time. And then they can clot and form an embolism in the blood vessels as well. And then it can cause cable syndrome. Cable syndrome is where there are so many adult worms in the heart that it cannot beat properly anymore, and so it can cause heart failure. Now your microfilaria, they can destroy your fine capillaries, but just kind of like the adults, they are also scary when they start to die because they can cause a huge immune response that impairs your glomeruli. Microfilaria can carry the bacteria Wolbachia. It is a symbiotic relationship. So when the microfilaria begin to die, they can release Wolbachia. Wolbachia will release endotoxins, which then can lead to lung injury. So going up here, our infective stage is going to be the L3 that we get from the mosquitoes. The diagnostic stage is going to include female worm antigens, which is called the uterine antigen, and then microfilaria in the blood. So diagnosis can be a little complicated. You can just do it based off of clinical signs. An antigen test tends to be a SNAP test, and then you always want to look for microfilaria in blood. So we're going to break down the antigen test first. So you can have false negatives and false positives as well. So if it is a false negative, so your dog has heartworm, but it's not reading on the test. It can be because they have a low worm burden, so it's not producing enough antigen to be able to be read on the SNAP test. You have immature females, you have a male-only infection, which if it's male-only, you also won't have microfilaria. It can just be user error. And then there could be immune complexes. So if you There's a thing with like soft treatment, which we'll get into down here, where they get exposed to medications over time, and your antibodies in your body will form immune complexes around these antigens so that then it is not able to be read by the SNAP test. So what you need to do is, if you get a false negative but you're pretty sure your dog has heartworm, you can again just treat it off of clinical signs, or you can send it off for it to be heat treated, which will break down the immune complexes so that then it can be read on the antigen test. Sometimes you can get a false positive though. So let's say you had a dog that you went through the entire course of treatment and you retest it and it's false positive, or it's positive again. Could just be that your body still has those antigens floating around. There could be other worms that react with the test, and again, it can be user error. So like I said, you also need to do a microfilaria test in the blood. The standard test is what's called a Knott's test, which is like where you break down the red blood cells so that only the microfilaria are present. You can do a direct smear, but the problem with that is there is a symbiotic, or sorry, not symbiotic. It is symbiotic with us, and with the dogs, where it doesn't hurt them, and that is called acanthocheilonemia. This is another microfilarial parasite, but it doesn't actually hurt the dog. So Knott's test is the only way to be able to differentiate that, because when you put it on a slide, acanthocheilonemia has what's called progressive movement, where on the slide they will keep moving forward and moving forward, where Diarrhea immitis, they will move, but they're only going to stay in one spot. That's called static movement. So you can look it on the slide to tell the difference between those two. Sometimes you can have positive microfilaria but a negative SNAP test. And why is that? One, it can be other species such as our acanthocheilonemia. Immune complexes have formed. It can be transplacental. The adults have undergone treatment, so you have been killing off those adult female worms, so there's no uterine antigen being produced, and there can be contamination of your test as well. Okay, so treatment. You have your heartworm preventatives. Those are effective on your L3 and L4 stages. All of our heartworm preventatives contain macrocyclic lactones, so anything that tends to end in mectin is a macrocyclic lactone, so ivermectin and those kind of things. Important with these is you need 2 to 3 doses for it to start being effective. One dose isn't going to work. If your dog has developed cable syndrome, you have to do surgery to remove it. There's a really cool video that she showed us where the guy took a red rubber catheter and made like a little catchy thingy with the sutures and shoved it into the jugular vein and pulled them out. Pretty cool. But the success of that is always going to be guarded. Melarsoline is the adulticide, so it targets the adults. There's a whole course of like the treatment protocol that you go through. Biggest things to remember off of that is there's 3 doses that you will give, but it needs to go in the epaxial muscles between L3 and L5. And if you hit a blood vessel, then it can cause major necrosis. So it has to be a proper placement. You do need to prevent exercise because, like I said, the adult worm, so you're doing melarsoline, it's killing these adults. If you start doing exercise, your heart is pumping faster, so it's going to pump those adult heartworms out, and it can cause that embolism that is so dangerous to them. Doxycycline is also going to be included because that is what's going to kill our Wolbachia. There is an issue with treatment. There is a thing called a susceptibility gap, where when our heartworm has entered the L4 in the juvenile stages, we have nothing to treat against that. So, it just a sad face. Control, do our continual heartworm preventative. People need to do it anyways. It doesn't matter if they travel. It doesn't matter any of those kind of things because it is found everywhere. This has a reach back and a reach forward effect so that it can like kill them from the past months and kill forward, which is really important to keep an eye on that. It has a huge incidence here in the Southeast, but it is found all over the United States. And so then there's a lot more of the signs, so I put it at the end. The main things to remember is initial disease is going to be pulmonary disease because everything on the right side of the heart is associated with pulmonary disease. When it's gotten so far, such as like Cavell syndrome, you will have cardiac disease. So Cavell syndrome, you will have lethargy, a heart murmur, systolic heart murmur, enlarged jugular veins. There's cat hair on this board. Labored breathing, hemoglobinemia, then hemoglobinuria. This is just going to be your general symptoms. So before it's reached this stage, so there will be cough, cyanotic mucous membranes, a heart murmur, tachycardia, rough appearance, ascites, ataxia, syncope, or passing out, and then they are exercise intolerant as well. So this part is going to be diaphilaria emetis, but it's going to be in the cats. So all of that up there is going to be the same. The main difference is that the microfilaria in cats tends to be uncommon because their life cycle is a lot shorter. The life cycle will be the same up until we reach the immature adult. So mosquito eats the microfilaria out of another host. It's probably not going to be the cat. L1, L2, L3 goes to the salivary glands. Mosquito will bite, spit, L3, which crawls on the wound, lives in the subcutaneous for 3 to 4 days, goes L4, thorax, immature adult. Once it gets here, the cat immune system is pretty good about attacking it here. If it does pass through, cats will only have like 1 to 3 adult worms. But this is the part that is so deadly to them, is the immune system kills them, but the immune system has an overreaction. So this is where the pathogenesis comes in. The Barrett migration is more common in cats, but they tend to get what's called heartworm-associated respiratory disease, also known as HARD. And there's 2 stages based off of which stage of the heartworm we are in. So stage 1 is when the immature adults, so this stage right here, reach the lungs and they cause massive inflammation and asthmatic symptoms. And then once the immune system starts to kill them, it'll just make this immune response worse. Stage 2 is when the adults begin to die and it causes extreme inflammation, edema, and respiratory failure. So our signs with it are going to be cough, dyspnea, chronic intermittent vomiting, anorexia, lethargy, asthma, weight loss, which what sucks is like these tend to be common symptoms in just really sick cats, and it can cause sudden death. Infective stage is the same, L3. Diagnosis stage is the female worms, antigens, but again, the adults have a short life cycle and are less common in cats, so the antigen test tends to be poor. Technically there's microfilaria, but again, short life cycle tends to be poor in cats. So the best way to diagnose this is going to be an antibody test in the cats. Single-sex infections are more common. Main thing with treatment is you do not treat with melarsoline. That is very toxic to cats. You have to do surgery to remove the adult worms, and then you just have to treat supportively until their immune system can take it out. And then to control it, you do cat macrocyclic lactomes. You do not treat with dog types. It has to be cat specific.